A number of children, most of them in New York, have been diagnosed with a rare and dangerous inflammatory syndrome, possibly linked to COVID-19. Doctors say the affliction has surfaced in Missouri, and KRCG 13's Kyrian Lee has spoken to an MU Healthcare infectious disease specialist about it.
Dr. Christelle Ilbudo says the inflammatory syndrome is thought to be post-infectious. She says it's an overreaction of the immune system, and this disease is said to be similar to Kawasaki's disease. State Health Director Dr. Randall Williams says there's no cure for it. He says an infected person needs to be seen and let the body recover itself. Dr. Williams says he's unsure of the exact number of inflammatory syndrome cases in the state. However, he says there have been cases in both Kansas City and St. Louis. Dr. Ilbudo says it's tick and fever season, so it's important for parents to pay attention to any lingering effects in children, such as prolonged fever, vomiting, or diarrhea.
Most of these inflammatory syndrome present with fevers for more than 5 days. And the other symptoms that they've described is that they tend to have low blood pressure. So children who have fevers for more than 4 or 5 days, but are also dizzy or have a low blood pressure, would be my triggers to get them seen.
We asked Governor Parson if inflammatory syndrome draws any concern with schools expected to reopen this fall. He says himself and the state health department are looking into it.
We're concerned about all that. We've been very fortunate so far. It hasn't affected our children like we thought it was. And again, I go back to when this all began. None of us knew who it was really going to target so much. We didn't know whether it was going to be, whether it's our seniors with underlying health issues or whether it was going to be children or middle age. We didn't know. We do kind of know that now.
As Missouri's economy begins to reopen, Columbia and Boone County have imposed rules that are stricter than those coming from the state. Officials there have left those local conditions fairly open-ended. And as KRCG 13's Ashley Eddy is finding out, a lot of people disagree.
Both protests and petitions have been seen in favor of and against those restrictions that are in place in the city and in the county. Columbia and Boone County officials say their guidelines are stricter than the state's. Knowing this, many have differing views. Under the order, business owners face restrictions, and entertainment venues and bars remain closed. Some business owners saying this violates their First, Fifth, and 14th Amendment rights. Last Thursday, dozens of demonstrators gathered outside Columbia City Hall. The group Open Columbia Coalition claims to represent the different businesses and individuals who have been affected by the Columbia and Boone County order.
We can resume business. We can wash our hands. We can wear protective gear. We can do social distancing, and then isolate people in cases where we do see symptoms, see at-risk people or have spikes, then we react accordingly.
On the other side, some are happy the order is more restrictive. A petition started online by Como Speaks is expressing thanks to Columbia and Boone County Public Health and Human Services Director Stephanie Browning. The petition goes on to say, in part, quote, "Those of us who have been laid off or furloughed or had medical procedures delayed are particularly stressed and justifiably concerned about how long this will last." Director Browning understands all of these concerns. The petition has over 1,500 signatures.
With the coronavirus pandemic here, many pregnant women and families have worries about bringing their new little ones into this world. So I talked with an OBGYN with MU Healthcare about how families can put their worries at ease and what they should expect when that does happen.
It has been a really interesting ride.
Dr. Melissa Terry says this has been a challenging time.
Our clinic appointments have changed to the point where we do not allow any visitors during appointments, and that's consistent across MU Healthcare. In order to get into appointments, patients have to go through a pretty extensive screening process. And then as far as delivery and inpatient obstetrics goes, we are allowing only one visitor, which is a change for us.
She wants to ease some of the fears for pregnant women worried about the virus.
The baby is very protected inside of mama. There has been no evidence of what we call vertical transmission, which is transmission from the virus to the baby inside mom's uterus. So that is really great news for pregnant women. The virus has not been found in either amniotic fluid or breast milk, and so that's great news for after delivery. And then the last piece is that we know that children and young people actually do fairly well with this virus.
She encourages pregnant moms to maintain a healthy weight, continue exercising at the same pace they were prior to pregnancy, stay well hydrated, wash their hands, and continue social distancing.
We really encourage people to maintain their normal obstetric plan. If they were planning to deliver in the hospital, we want you to come to the hospital. We have taken extensive preparations. We have made extensive preparations to protect our staff and our patients. Most significantly is the fact that when we have someone who is either COVID positive or a person under investigation, we are keeping them on a completely separate floor of the hospital. And I really, really want people to be reassured that we're doing everything we can to make sure that we continue to have great outcomes.